Good evening and welcome to Resource PNG. On the show, we continue with our fifth feature in a series of documentaries sponsored by the Chamber of Mines and Petroleum to highlight the scope of resource industry activities in the country. Tonight, we look at how the resource industry has participated in health initiatives.
It is widely recognized that Papua New Guinea has some of the worst social and health indicators in the Asia-Pacific region. Although the national government pours hundreds of millions of kina every year into hospitals in the health sector, many hospitals and aid posts remain in dire need of renovation and modernization. Some remote locations have been left unattended by health workers. As a result, Papua New Guinea has among the highest rates in the Asia-Pacific of women dying during childbirth. There are excessively high mortality rates for newborn babies and for children below the age of 5. Many aid posts around the country remain unstaffed and, from time to time, even the major city hospitals report the unavailability of basic medicines and essential drugs. This sad and dismal picture is not reflective of the situation in mining and petroleum-related townships such as Tabubel and Kiunga in the Western Province, Payam in Enga Province, Lihir in New Ireland, Hides in Hela Province, and the Moro Kutubu area in the Southern Highlands. Doctors and health workers in Tabubel, Payam, Lihir and Hides confirmed that in the last 4 or 5 years, there have been not a single case of mothers dying during childbirth at these hospitals and health centers. Infant mortality is also extremely low. This is as good a record as for hospitals in the Western world. At the oil search base at the Hides gas operation, Sister Anna Golong has been assisting in the training of nurses in nearby public health facilities. She says the zero maternal mortality in recent years is due to the training and skills upgrading made available to health workers and because oil search, when necessary, provides the logistics to ensure that medicines and drugs are always available.
We have what actually also just done was that we used to fly them medical supplies in from Mount Hagen, where they used to find it hard for in delivery. So we used to bring a lot of the drugs here. A maternal child death, the 5 years I've been here, we haven't come across any mom that died.
The situation is much the same at the Tabubel Hospital, not far from the Oktedi open pit mine. There is public recognition that this is a high-quality facility, with women in particular walking for days from neighboring provinces to seek free medical attention here.
Tabubel Hospital. It's comparable to some of the smaller hospitals or district hospitals or smaller hospitals in Australia. Yeah.
World-class facilities are also available at the hospital run on behalf of Newcrest Limited by International SOS at Lihir.
And we give service to the mine workforce as well as to the 16,000 people that are living in the communities around the island. At the outpatient department, we see approximately around 80,000 cases annually, and half of them are mine workers. Many have malaria. TB, HIV, gastroenteritis, and pneumonia are other important sicknesses. With regards to the maternal and child health care, we've got a program of antenatal care where we review all the mothers from at least twice or 3 times during the pregnancy. The rate of maternal mortality has dropped to levels of 0.
Malaria, one of the big killers along with TB and HIV/AIDS, has been eradicated for the past 15 years from the Hides area in the Hela province. Ongoing measures have ensured the disease is not reintroduced. Each of the major resource projects have adopted slightly different models in tackling health issues within their spheres of operations. The Oktedi mine, with some financial support from the Western Province provincial government, has been operating the Tabubel Hospital for many years, turning it into one of the finest health facilities in PNG. Similarly, Payam Hospital was originally operated by the Pogora joint venture for many years. For the purpose of sustainability, the management of Tabubil has recently been taken over by Divine Word University, while Payam comes under the Pokhara Development Authority. Health clinics operated by Oil Search at its Hides and Kutubu operations provide a wide variety of outreach support and services to medical facilities in these areas, including the Pimaga Rural Hospital near Muro. Prior to the establishment of the Pokhara mine, the district did not have any hospital. The entire area had 5 nurses attached to a health center and 14 aid posts. Today, the Payam Hospital itself has 4 resident doctors and some 40 nurses. It receives financial and technical support from Barrick Gold. In addition, there is the Pokhara Urban Clinic and 9 medical centers. Mining ventures are located in remote areas. The Tolokuma mine is only 100 kilometers north of Port Moresby. Because of a lack of road from Port Moresby, supplies are flown in by helicopter. Despite high operating costs, even a small gold mine like Tolokuma, which is owned by Petromin, also provides health services to local communities. Communities in remote and difficult to access villages, such as those along the Fly River in Western Province and in most parts of rural PNG, have poor levels of public service delivery. Doctors, nurses and teachers are reluctant to live and work in such areas. In the early years, many mines faced technical and financial challenges. This was the case with Oktedi and Lihir, and more recently with the gold-silver mine at Hidden Valley and the nickel-cobalt operation of Ramu Nickel. Because of the dire need for better services in most remote areas, from day one these operations are expected to provide a wide range of services to mine workers in local and regional communities. This is also the case with medical and health services. New prosperous townships are born in this manner.
More of this documentary after the break. Welcome back. We've seen in the last segment Papua New Guinea's position in the Asia-Pacific region in terms of health indicators. Sadly, PNG has the highest rates of infant and maternal mortality. But resource project developers have come on board in a big way to assist health services as part of their community engagements.
Although the mineral resource was first discovered half a century ago, Papua New Guinea's newest mine, the Ramu Nickel mine, only came into production late last year. The mine, operated by the Metallurgical Company of China, or MCC, was built at a cost of almost 3 billion kina and is still undergoing commissioning. It provides a good and current example of benefits that flow to remote rural communities from a mine development.
So MCC has assisted with quite a lot in this regard. They've provided a salary for a person to staff that aid post, and they also provide funds for him to be able to purchase medical supplies. So since the mine has been operating, the aid post has been operating quite well. Now there is a further development which is about to take place. MRA have agreed to provide financial assistance for the upgrading of the aid post to a sub-health centre. So those funds, Busmark Enterprises has applied for the contract to construct that health centre. If we do win that bid, we'll take on that contract, and the value of that contract will be about 1.8 million kina. And that means we will have a ward for inpatients. We'll have there'll be 3 houses constructed, an incinerator, and proper ablution and toilet facilities. So that will go a long way to improve the health services that are necessary for the people in that area of the Rye Coast. When I first went there was a large amount of people who were suffering from tropical ulcers, from scabies and from grilli. I used to have people knocking on my back door on many occasions, and I'd help them where I could. But these days, those conditions are not so common. In actual fact, they're quite rare. So that has been quite a dramatic improvement.
8 post-servicing villages around the Bassamak processing plant were left unattended prior to the construction of the nickel processing plant. Now the Ganglao Clinic is a bustling hive of activity with mothers and babies lining up for health checks and immunization jabs. 3 doctors work here. Dr. Baksan Masa, himself a Rye Coast man, was flat out seeing patients in his crowded clinic. At mine sites such as those at Ramu Nickel, improvements in livelihood and health come not only from provision of improved medical services. Ramu Nickel also fosters improved cash cropping and growing of various vegetables and food crops, which enable local communities to purchase necessities as well as to improve their nutrition levels. In the past 2 years, the population near the processing plant has gone from about 1,000 people to 2,500. The newfound prosperity of the area is certain to attract more arrivals. People living near the Bassamak processing plant, as is the case with Lihir, Pogra's Payam Township, and at the Optedi towns at Tabubal and Kiunga, receive free water and electricity, which also contribute to healthier lifestyles. In the event of emergencies, companies such as Ramu Nickel, Pogra and Optedi mobilize resources to evacuate people for urgent treatment at major regional hospitals or in Port Moresby.
Resource PNG continues when we return. You're back with Resource PNG. We continue our 5th feature in a series of documentaries sponsored by the Chamber of Mines and Petroleum, with tonight's focus on contributions resource developers have made to PNG's health sector.
The situation at Bassamak today is a reflection of conditions 3 decades ago high up in the Star Mountains in the Western Province. The opening up of these cloudlands by Optedi Mining Limited heralded major improvements in public health. The Mint people who inhabited this rugged terrain for millennia had a life expectancy of around 34 years, largely as an outcome of the widespread affliction with malaria and microfilariasis. Peter Balangol from Manus was a young man when he joined Optedi's public health team in the 1980s.
When the project initially came in, one of the priorities was the health service, to bring the health service into the remote areas, into the villages. So the public health component of the program was very important at that time, which we went out to the villages and we did all these projects and surveys and so forth.
Sick people and pregnant women walk for days from the neighboring provinces to avail themselves of the world-class treatment available at Optedi's Tabubal Hospital. It was originally built primarily to service mine employees. In the past 3 decades, the hospital has grown by leaps and bounds, and further expansion is imminent. These days, it services around 40,000 residents in Tabubal. Local people in this prosperous township even invite relatives and friends from the rest of PNG to see doctors and specialists at the hospital. Optedi contributes 18 million kina annually to operate the Tabubal Hospital. An additional 6.7 million kina is provided by the Fly River Provincial Government for the 5-star designated facility, which is a major referral hospital for Western Province. When the Resource PNG team was visiting, there were advanced plans made for specialists from Australia to carry out cataract surgery on some 50 patients. Other specialists are flown in from time to time for similar programs for the public.
Tabubal Hospital becoming a 5-star hospital is because of the resources available at the disposal of the health workers here, and that is through funding from OTML. This hospital belongs to OTML, and it is its responsibility to make sure that it's funded, it's functional. At the same time, whilst health workers here, including the management, we are carrying out implementing those programs, we are guided by the national health standards, which is the basis for the accreditation, and also the national health policies, the national health plan. We charge 3 kina for adults. We do not charge children and pregnant women. We don't do that. However, if they come without any fees, we still treat them. Here, the drugs that we give out to them are free. We give them free treatment. And that is basically because that's the policy of OTML.
More when we come back. Thanks for staying with us. In this next segment, we continue to see how the mining sector has complemented government policies that have improved health service delivery in PNG.
By working closely with key government agencies like the National Department of Health and provincial authorities, the mining sector complements government policies and contributes to improved service delivery. One of these key national policy targets has been the fight over the past decade against HIV and AIDS. Hospitals at Tabubil and other mining communities employ specialist health workers who provide voluntary counseling and testing as well as ongoing treatment, including the provision of antiretroviral therapy. Oktedi, Pogra, Lihir, Ramu Nickel and Oil Search ensure that hospitals and clinics where they operate receive a constant supply of medicine and drugs and never run out of supplies for patients with malaria, tuberculosis and HIV/AIDS. By complementing supplies from the National Department of Health, they make sure that ongoing needs are satisfied even though populations at towns like Tabubil, Kyunga and Payam have grown several-fold over the years.
The HIV/AIDS program was introduced. We had a staff recruited to coordinate the whole program. And also because not only the mining workers, but we have the community, surrounding community, and we have a lot of infections coming from the surrounding community. We have 2 major settlements around here. So the program we have now is not just doing voluntary counseling and testing, but we also have ART program in place. ART is like antiretroviral treatment. So any employees, any dependents who is HIV positive, the new protocol now is anyone is detected positive, we put them right away on ART, on the treatment. And we also have a CD4 count machine, which it tells us if the patient is qualified to go on ART treatment. So we do a blood count and we see the level of what we call CD4 cells and so forth. So if the level set, we can put the client on ART, then we put them on ART. A lot of people come from other provinces to access service here, like Teleforming in Sundown. Those who come from now, we call the Hela province, they come into here, the Southern Highlands. They walk, most of them walk. They walk into here just to get the service from here.
For the past 5 years, after being here, we went through the EMI program, training at Goroka. That is to do with integrated management of adult HIV and AIDS. So through that, we came and then started with the ART clinic.
And visit basically to identify healthcare workers. We closely work with healthcare workers, and it's focused in HIV, and to find out, to see the knowledge they have, and during the visit, if we identify if they have issues with understanding the knowledge about HIV, we identify them and we train them. In that process, after the training, we provide ongoing mentoring, coaching, and support to the healthcare workers. And I've contributed and I've touched some people's life in one way or the other in health. most of the people, they know that the drug is here, and they know that people can survive with a drug longer. Stigma has been an issue around here before I came here, and due to the work that we continuously to do throughout the year has reduced. People accept HIV positive people, and this is one of the things. And like, for example, in Pimaga, one of our patients openly came out and told the community that I'm HIV positive, and Oilsearch Health Foundation is providing me treatment, and I'm on treatment now.
Facilities supported by resource companies are spotlessly clean. Despite its 3-decade history, this is just as true for the Tabubal Hospital, where 4 medical specialists and a very experienced physician are located.
The general environment is cleaned. Like there is a general order it's easier for you to find where you're going to find those services and so forth. And there is a sense of, like you could feel a sense of things here are going well. Some of our biggest medical problems that we have here is first of all, TB, tuberculosis. We have increasing number of tuberculosis over the years. And in addition to that, we have identified a number of cases we are resistant to TB treatment. We also have increasing number of HIV/AIDS cases. We have malaria problems and so forth, and which are common in, not only restricted to here, but they're also common in other parts of the country.
According to Belongol, the population at Tabubal has grown from around 600 to 900 people 30 years ago to a current population of more than 30,000 people.
We also have the disease control, and the disease control, we look at our disease. We had a surveillance program, and we have a TB, the two main programs under the disease control. And just a couple of days ago, we have a typhoid outbreak here in our community, but it's not within the workforce or in the Tabubal township, but it's in one of the major settlements that's across the river. We send our health promotion team into the area to talk about, to give health awareness and to the community, to the people living in the settlement. And the health promotion section deals mainly with carrying out awareness, carrying out health education.
We've got 4 doctors here working. A surgeon who looks after all the surgical cases. We've got the option gynae doctor who looks after maternity and gynae or mother's health. And we've got Dr. John Oakley who looks after the children, pediatric cases. He also sees other adult cases as well as children's. He looks after experts as well. So that's it, and a physician, which is myself. I look after adult medical cases. All of us have done our postgraduate studies.
Dr. John Oakley, a physician, has been working at the Tabubal Hospital for the past 3 years. Having spent 30 years working within the Western Province, Dr. Oakley is particularly concerned about the increasing incidence of lifestyle diseases such as hypertension and heart problems and diabetes.
And it's been a privilege to work in Tabubal Hospital because this hospital is able to provide a high quality of service to the town and the surrounding community. And there's a very positive attitude to try and improve health services. I'm just a GP, a jack of all trades, but I get involved with mainly children here, and it's wonderful to see children getting better with good health care. But there's still many needs, there's much that needs to be done. Some of the challenges before us, of course, tuberculosis is a very hot topic at the moment. We're seeing a lot of TB, and we need to improve our care of TB and our detection of TB cases to try and get this epidemic under control. And another area of big concern to me is maternal and child health. We need to find ways to encourage young mothers to attend our clinics for family planning, antenatal care and delivery in the hospital, because we're seeing a lot of problems with young mothers and their small babies. And a third area of concern is diabetes and high blood pressure, the diseases of modern lifestyle. We're seeing an epidemic of these. We're diagnosing a new case of diabetes almost every week.
The Small Beginnings Foundation, a community assistance group formed in Tabubil 2 years ago, has since published a book, Tabubil, Town and Beyond, which, as OTML Managing Director Nigel Parker put it, reflects the thriving community spirit evident in Tabubil. In a little commentary on health, it proclaimed the Tabubil Hospital is second to none in PNG, citing that in 2010 alone, it had undertaken 4,655 theatre operations, filled 27,501 prescriptions, admitted 840 patients, and delivered 728 babies, in addition to 5,346 dental clinic visits, 5,798 x-rays, and 59,008 pathology tests. Since the Octady mine began operations, the book notes that infant mortality has reduced from 129 to 15 per thousand births. Life expectancy has risen from 30 years to 50 years, with incidence of malaria among children having fallen from 70% to 15%. As with Octady, Pokhara and Ramunickal, prior to the start of mining on Neolem Island in New Ireland, the community had no access to healthcare. There was no doctor based on the Lihir Island. These days, the Lihir Medical Centre alone has 5 doctors, 28 nurses, 9 health extension officers, and 5 community health workers. Funded by the mine to the tune of 10 million kina annually, its services include surgical facilities, a maternity ward, pharmacy, and dental clinic. A social demographic health survey carried out in 2010 showed that the health of local people has improved greatly since 1991. Conducted by the Centre for Environmental Health and the Medical Research Institute of PNG, it found that undernutrition, prevalent in 1991, was now absent in all age groups. There was also a reduction in skin conditions, including sores, tropical ulcers, and tinea, with markedly improved maternal and child health. As was happening elsewhere in PNG, the transition to more urban-style living conditions had brought lifestyle diseases of obesity, which together with smoking-related illnesses had to be dealt with almost on a daily basis at the Lihir Medical Centre.
Resource PNG continues after the break. You're back with Resource PNG. In this next segment, we see what outreach programs, training and development initiatives mining and petroleum companies provide within the health sector.
All resource projects and advanced exploration sites often provide emergency evacuations by air, boat, and road for people who are critically ill. In addition, Octady, Pokhara, Lihir, Ramunickal, and Oil Search ensure that clinics and aid posts in their operating regions are properly manned and adequately stocked with drugs and medicines. Resource projects also provide logistical and professional support for community health clinics and coordinate health assistance programs together with the national and provincial governments, community groups, and non-governmental organizations. Many also undertake preventable and curable disease control patrols in remote parts of host provinces. For example, a Pokhara joint venture doctor normally accompanies government health officers on the riverine health patrols, immunizing children and providing mosquito nets and treatment for filariasis.
Tax credit scheme actually spends money in two areas. One is basically concentrated where the mine is, and the other is actually working on outside of the footprint areas. So we work in Tari, in the riverine, wherever we have our footprints and the mine is actually divided among all these places. And we have health centers in Tomu in the West Sepik province. Wherever our footprints or mine operation lies, we have tax credit scheme projects everywhere.
Dissatisfaction with national and local government provision of local and regional health services led the Octady Board in 2008 to agree to fund a 5-year program for the North Fly region. Since 2009, the company has been spending the equivalent of 4 million kina annually on the North Fly Health Services Development Program. The 20 million kina investment over 5 years may appear small, but outcomes to date have been dramatic. In the short space of 4 years, the once minimally serviced North Fly region has seen a transformation in its health indicators. Maternal and infant mortality has fallen below the national average. Experienced nurses walk to the most remote villages these days to provide medical advice and health checks and much-needed medication.
The population of North Fly is probably around 60 to 70,000. Normally, I think most of the districts, if you compare them throughout the country, that's the normal population is within usually a district is around 70 to 8,000. But with the North Fly, because of the mining communities and other development projects, we probably tend to have a little bit more population. So we're probably looking around close to around 80,000 people. That's my estimate of the demographics we're looking at. So we got 3 major district health facilities, unlike many other districts in the country. So because of the population size and the amount of development, economic activities happening, we tend to have this number of facilities. And on top of that, we've got about 27 health facilities. That's for the North Fly district alone that we have to cater for. So back in 2007, it was around 55%. And today we are on 75%. So we've made some progress in terms of some of the immunization coverage areas. So some of these vaccines that we use, for instance, the pentavalent, it protects against whooping cough, diphtheria, tetanus, and things like that. So malaria incidence is starting to go down as well. Because we've done a lot of bed net distribution, we've done patrols, we've issued bed net drugs to those places. We are using the new rapid diagnostic tests, which have been provided by the National Health Department. So we've done a lot of program along the malaria side of things. And even with the help of RAMS, Rotary Against Malaria, it's a combined effort, and I think with the partners we've been able to start to see some of these figures are starting to come down. For instance, in 2007, I think we saw something around, of 400 and almost to 500 cases of malaria per 1,000 population. Now it's come down to 342. So actually we've made some big progress there, and there's a reduction in the number of cases that we're starting to see. So
a district health officer in the North Fly area, John Lowry, says the North Fly Health Program has built up partnerships among all health service providers where none existed before. Health outreach programs are better managed, along with medical supplies and logistics. Cold chain fridges exist at all 8 posts, ensure quick availability of medicines and drugs, and training and scholarship programs for local health workers are a part of the regular program, he says. In the past, it was difficult to attract health professionals to rural areas, but this is not the case when locals receive specialist training. The ExxonMobil-operated PNG LNG project has also had a big impact on health services in the 5 provinces in its project footprint area: Western Province, Hela, Southern Highlands, Gulf, and Central. ExxonMobil has been donating sophisticated medical equipment to upgrade facilities and services at many hospitals. Most recently, it supplied 130 items of medical equipment to hospitals and health centers within its footprint area. These included bed monitors, defibrillators, freezers, electric hospital beds, infant incubators, IV pumps, examination lights, microscopes, nebulizers, X-ray viewing boxes, and ultrasound machinery. It has agreements in place which enable PNG Institute of Medical Research personnel to train hospital staff in the use of various specialist equipment. From its key bases at Hides in the Hela province and Kutubu Moro in the Southern Highlands, Oil Search has also been providing financial and technical assistance to hospitals and health centers within its footprint area. Sister Anna Golong told the Resource PNG team, people in the Hides area have told her that when the company came, malaria ran away.
Company started the annual malaria spraying, which is now an annual activity in the community where the company does residual spraying. The spraying program has been very successful, and we continue to do so, and I'm glad to say that there's no further death from malaria.
What actually also just done was that we used to fly them medical supplies in from Mount Hagen, where they used to find it hard for in delivery. So we used to bring a lot of the drugs here for them, so they add drugs on hand to treat. So the maternal child death, the 5 years I've been here, we haven't come across any mom that died. I'm privileged to work for a company that has moved into the community where transport accessibility and drug accessibility, those are the things that hindered the health of people in general. I see that what the company is doing is empowering the nurses, as well as accessibility to treatment is for the people in general is good, as improved.
Yes, I'm Sister Wendy Kafa, and I've been working here for 27 years. Our MCH work, I believe we've improved a lot with the children's clinic and antenatal mothers, family planning, and when this visit is set up through, we see there's a lot coming, and which is good, which is one of those some of those seven health registries we are doing here.
Under the tax credit scheme, Oil Search has constructed permanent houses for nurses working at the Juni Clinic and under its Marasin storekeeper. Many village women have been trained to carry out early diagnosis and treatment for malaria. They are trained to use a rapid diagnostic kit and to supply pre-packaged doses of malaria medication. Oil Search has set up the Oil Search Health Foundation to roll out its anti-malaria, TB and other medical and health programs nationwide with additional funding from global partners.
We set up our health foundation, the Oil Search Health Foundation, last year because we'd built up expertise within the organisation on community, specifically community health issues such as malaria control and eradication, TB, HIV/AIDS management, all of which we saw as challenges in our local communities in the oil fields. And having built that expertise to look after our local communities, we saw that could be extrapolated across the rest of the country. And now we're working in 9 provinces around the country, doing major HIV/AIDS management programs, health education, child maternal health issues, HIV/AIDS, I've mentioned, malaria.
Stay tuned for more of Resource PNG.
Health services management to this facility, Tabubil Hospital, the 6 mine villages, 8 posts, the mill and the mine clinic, the Kiunga OTML clinic, and Bige OTML clinic. In addition to that Part B, the agreement requires that OTML and Divine Word University work collaboratively to develop this hospital into a training hospital in the future.
Margaret Sami explained that one of the goals of the Divine Word University was to turn the Tabubil Hospital into a training hospital to meet the PNG government's Vision 2050, human resources targets, and to implement a rural medical doctors program.
The plan is to develop a curriculum, and currently there's a team that is working on that curriculum now. Hopefully that should take place, should become materialized after 2015 and onwards. There is some plan now, there is a plan already in place now to have infrastructure development take place before the program comes in, which implies 2 things. Firstly, there must be housing available to accommodate additional staffs that are going to come in. And secondly, there must be housing for students
Health facilities managed or set up by resource companies have achieved world-class outcomes, sometimes in relatively short periods. The Misima gold mine only operated from 1989 to 2004. In that 15-year period, it gained international attention after Misima Mines and national government health staff conducted joint patrols to villages and nearby islands. In just 3 years, from 1996 to 1999, PNG health workers reduced average filariasis infection rates to less than 0.6%, virtually eradicating the debilitating mosquito-borne infection on manus. In less than a decade after the first gold pour in 1995, the Lihir gold mine had made its mark in the world of preventative medicine by treating record numbers of tuberculosis patients. Some 95% of community children were fully immunized by 2003. There were also successful programs for malaria, filariasis, cervical cancer and dental treatment. At Heights, when the gas-fired power station for Pogara was built in 1990, 1 in every 2 of the local Huli people were affected by malaria. By the end of the decade, malaria had been virtually eradicated. A constant watch is kept on reinfections caused by carriers who enter the area. For at least 15 years, Heights has remained virtually malaria-free. Gas from Heights is now at the heart of the $19 billion PNG LNG project, which commences LNG exports next year. PNG Prime Minister Peter O'Neill has declared his determination to upgrade and improve service delivery at major hospitals in Port Moresby, Lae, Wabag and elsewhere. While maternal mortality rates in PNG remain among the highest in the Asia-Pacific, medical facilities run by Okteri, Oil Search, Pogara and Lihir in different remote parts of PNG have in recent years had 0 levels of maternal mortality. At these hospitals and health centres, mortality rates of children under 5 has also been reduced dramatically. Okteri's Tabubal Hospital serves as a wonderful model that shows Papua New Guineans can manage and implement world-class outcomes. The hospital and its outreach services to mines and villages and clinics in Bige and Kiunga is managed by Margaret Same, who hails from East New Britain, along with 4 medical specialists, all of whom are highly qualified and competent Papua New Guineans. The North Fly Health Service Development Program, at a mere cost of 4 billion kina annually, has in the last 5 years improved health indicators such as maternal mortality rates below national averages in an area that has long been neglected. Okteri Development Foundation is currently in the process of replicating the North Fly Health Services Development Program in the Middle Fly and South Fly regions. Success in achieving better health outcomes by the resources sector are clear proof that with dedication and determination, PNG's health sector can make dramatic improvements in provision of health services and in its key health indicators.
That ends Resource PNG, brought to you by the PNG Chamber of Mines and Petroleum. If you have any comments or queries, do email us on this address, resourcepng@mtv.com.pg, or to find out more, check MTV online, that's www.mtv.com.pg, and go to our Resource PNG page, or you can check our page on Facebook. Thanks for your company. Bye for now.